You are welcome to my channel. Thanks for visiting. Remember to subscribe if you haven't. But if you have subscribed and you are visiting again, I'm saying a big thank you. And also for sharing all my presentations and listening to this very one on Fluticasone. Fluticasone. Which type of medication is this? What is it used for? How can we use it? Different brands available out there. Which ones have been banned and where? Let's go. The first note here is that Fluticasone is anti-inflammatory agent. It is an inhaled corticosteroid, commonly through intranasal route, but you can take it through the mouth depending on what we are targeting. We'll know in a bit. Or could be given topically, particularly when we're addressing rashes, psoriasis, and co. And intravenously, but not commonly used in that way. We'll know in a bit. It's one of the essential medicines as being tagged by World Health Organization. It is expected to be used every day, maybe once daily or twice daily. We'll know all this in a bit. Should be combined with a bronchodilator or whatever other agents we can use when we are dealing with acute phase of asthma and so on. Approval. Someone will ask, why are you diving into that? Okay, let's just spend some seconds to know. Fluticasone furoate, that is Arnuity Ellipta, was approved in US in 2007 and the same in Europe, that is European Union, the year after, 2008. Fluticasone propionate is approved for use in a child that is 4 years or older, while Fluticasone furoate is okay for a child that is as young as 2 years. Generally, when using this medication for treatment, we'll consider the corticosteroid that has been working for this person before. Then we'll consider the severity of the asthma, COPD, esophagitis, and so on that we want to treat. And we'll consider the winning or losing trend, meaning since we have prescribed this medication, since this person has been taking it for this time, this period of time, has it been improving? Is it getting worse? Then we can alter the dose every 1 to 2 weeks. Why that? We don't expect a full effect to manifest until close to or after 2 weeks. Then we should think of 1 daily dose as better as far as compliance is concerned than twice daily dose. And of course, we must consider the cost because different people, different financial status. Fluticasone could come under different brand names depending on which one is available in your jurisdiction. It could be Flovent hydrofluorocane, that is a propellant in metered-dose inhaler. So it could be Flovent HFA or Flovent Diskus. Could be Apple Fluticasone, PMS Fluticasone, Arnuity Ellipta, ArmonAir RespiClick, ArmonAir RespiClick, or ArmonAir Digihaler. It belongs to the class of medications broadly called corticosteroid. In this case, inhalant per oral. It's an anti-inflammatory agent and also has some level of vasoconstrictive effect. So it's a vasoconstrictive agent. Forms. In form of aerosol, powder, breath, activated inhalation as furoate. In that case, could be Arnuity Ellipta 50 microgram, 100 microgram, or 200 microgram. Could be Arnuity Ellipta in United States, Flonase, Sensimist, that is over the counter for allergy, rhinitis, Alamist is the name given in Japan. Avamys is the name in India, South Korea, Australia, Canada, European Union, South Africa, or South America, and so on. In chronic obstructive pulmonary disease or severe asthma, you can use a combination of fluticasone with a bronchodilator like vilanterol, and when vilanterol is combined with fluticasone, it comes under the brand name Arnuity Ellipta. Still on forms, could be in form of aerosol inhalation as propionate. That was patented in 1980 and was approved in 1990. In that case, that will come under the brand name Flovent HFA 44 microgram, 110 microgram, or 220 microgram. Could also be as Flonase or as topical form of fluticasone, that is fluticasone propionate, that will appear in form of cream at 0.05%, useful for eczema treatment, rashes, and psoriasis. Still, other forms could be aerosol powder breath activated inhalation as propionate. In that case, it will be under different brand names: ArmonAir Digihaler, ArmonAir RespiClick, ArmonAir RespiClick, Flovent Diskus. But the ArmonAir RespiClick is being discontinued in the United States, meaning no more ArmonAir RespiClick in USA. Could be aerosol inhalation as propionate, and that could be under the brand name Flovent HFA or generic 250 microgram. Another form is aerosol powder breath activated inhalation, that the brand name Flovent Diskus 500 microgram. Here there will be milk protein. It could be in form of fluticasone furoate for intravenous use at 250 microgram. Repeated doses of inhaled corticosteroid and IV hydrocortisone had been put under investigations in the past. In mid-1990s, some experts worked on the comparison of the intravenous hydrocortisone and repeated doses of fluticasone. That is, those experts concluded that repeated doses of inhaled corticosteroid, specifically fluticasone, was more effective than intravenous hydrocortisone. So, the reason why many physicians probably will not be looking for intravenous fluticasone is repeated doses, particularly high dose, repeatedly, of inhaled corticosteroid is good enough. But in so many situations, we'll go for intravenous or oral corticosteroids. Administration. When you are given the DPI, that is dry powder inhaler, it may be under the brand name ArmonAir Digihaler. In that case, there's no need of priming. We will give this at the same time each day, and no need of volume holding chamber, no need of spacer. Then you rinse the mouth after use and spit it out. Don't swallow. Don't wash the inhaler. Use dry cloth, not water. Discard this inhaler when the counter reads 0 or after 30 days of foil pouch opening. I think that is pretty clear, right? If you are given Arnuity Ellipta, you don't need to shake the inhaler. You first of all exhale fully, then take one deep breath through the mouth without blocking air vents. Hold breath for about 3 to 4 seconds. Discard this inhaler when the counter reads 0 or after 6 days. When you are given Flovent Diskus, there is no need of spacer device. You can use this in horizontal position. Please don't tilt. Don't take it apart and don't wash it. Discard after 6 weeks if you are using the 50 microgram device, but discard at a longer time as up to 2 months if you are using 100 microgram or 200 microgram diskus. The meter dose inhaler could be under the brand name Flovent HFA. Here, spacer or aero chamber is required in children. This is to be primed before the first use. And when you have not used this for 7 days, please prime before you use. To prime, all you need is you spray 4 puffs into the air and shake well after each spray. You have to shake thoroughly for 5 seconds before each inhalation. You will see a figure 120 that will appear. Use the inhaler while inspiring or on inspiration is the same thing, right? 30 seconds should exist between inhalations. Renew this very medication at 020 and discard at 00. Oral inhalation in case of fluticasone propionate. In that case, Flovent HFA will be helpful. Then spacer is needed for children that are less than 5, and you add face mask in those less than 4. It must be primed, and when it reads 020, please refill. Still in children, the dry powder inhaler, that is fluticasone propionate, under ArmonAir Digihaler or ArmonAir RespiClick, you don't need to prime and you need no spacer. But in Flovent Diskus, no need of spacer, but you must activate. And you use this in horizontal position. You don't tilt. Discard Flovent Diskus 6 weeks if 50 microgram, but after 2 months for 100 and 250 microgram containing devices. If it is fluticasone full rate under Arnuity Ellipta, don't shake this inhaler. Discard after 6 weeks. Now, contraindications. If there is hypersensitivity to fluticasone or any components of its formulation, no fluticasone. If there is hypersensitivity to milk or lactose, then the individual will not be able to take the following, that is Flovent Diskus, Arnuity Ellipta, ArmonAir RespiClick, ArmonAir Digihaler will not be able to give it if there is hypersensitivity to milk or lactose. Then in the face of fungal infection, we'll keep it for now. And also if there is a known tuberculosis. More on contraindications. Specifically, ArmonAir RespiClick has been discontinued in USA, meaning no physician will be able to use that in United States. So if you are outside US and your health authority has not banned or discontinued ArmonAir RespiClick, please find out from your health authority and then discuss with the pharmacist. In Canada, you can't use Flovent HFA and Flovent Diskus if there's ongoing fungal infection that is not treated yet, or if there's ongoing bacterial infection, no Flovent HFA, Flovent Diskus. And also, if this individual has been diagnosed with tuberculosis, in Canada, under these 3 conditions, you cannot use these 2 different formulations. More on contraindications. It is not the only medication that should be used in acute asthmatic attack. And I put it there that I have to explain further. I put this under contraindication so that we will not erroneously conclude that now that I'm having acute asthmatic attack or my child is having acute asthmatic attack, I'll just grab my fluticasone and begin to inhale. Well, it's not a crime to do that, but that is not going to help you now in acute phase. So that is why I say it's not the only method. So you can use it, but it's not the only one to take you out of acute asthmatic attack. So you have to add other medications. There is a separate presentation on asthma and the treatment on my channel. You can check out for that. Moderate to severe liver disease, we will not use it. In osteoporosis, cataracts, or glaucoma, we will not use it. Oral corticosteroid may be needed in certain situations. When we are faced with acute asthmatic attack, there's an algorithm how to go about that. Mechanism of action. As an anti-inflammatory agent, for example, fluticasone propionate can inhibit mast cells, eosinophil, neutrophil, macrophages, and lymphocytes. It can also inhibit certain mediators like histamines, eicosanoids, leukotrienes, and cytokines. The vasoconstrictive fluticasone propionate is a potent corticosteroid that can cause transient vasoconstriction. So no one will likely prescribe this medication for the purpose of vasoconstrictive capability, because it's just going to do that transiently. Okay, it is going to be absorbed into the system through the lungs with Flovent Diskus at about 18%, but there will be less gastrointestinal tract absorption, and with that, because of the pre-systemic metabolism. Onset of action and half-life. The onset of action is about 1 to 2 weeks or even greater before you can have the full effects. So that is why I said earlier that this is not the medication you can grab when you are in acute phase of asthmatic attack and then you think you will get up. It's not a crime to grab it, it's not a crime to use it, but it's not the only medication you are going to use. So you are going to use it with some other medication to get out of acute phase, like Salbutamol, some call it albuterol, whatever the name you give it in your jurisdiction. So that's the way it is. Some will even add hypertropia, some will nebulize, some will give intravenous hydrocortisone, some will give per oral hydrocortisone, like prednisolone and so on, just to get out of acute phase. Because when you start using fluticasone, you're not going to get immediate result. 1 to 2 weeks, and maybe greater, before you have full effect. The half-life, let's check it. If you have fluticasone furoate intravenously, now the half-life is 8 hours. But if it's fluticasone furoate by oral inhalation, the half-life is 24 hours. What about fluticasone propionate by oral inhalation? The half-life is 11.2 hours. And remember, this is going to bind to protein very strongly, 99% bind to protein. Uses of fluticasone. I know majority of the people that will click on this presentation will be familiar with the use of fluticasone in asthma and probably also in COPD. But mostly in COPD, it will be combined with long-acting bronchodilator. In asthma, you use it to prevent inflammatory process before the acute phase. It's not the first drug of choice. I'm not saying it's out of place, but it's not the only drug or drug of choice in acute asthmatic attack. We use it in hay fever, nasal polyps, mouth ulcers, eosinophilic esophagitis, bronchopulmonary dysplasia treatment. Asthma again. So some will ask me, what's your business? Why are you coming back to asthma? Oh, yeah, I'm coming back to asthma because many people that will click on these, if you're not a physician, you're not a nurse, then it means someone around you is using it. And mostly for asthma. The rest will be for COPD. Okay? So in asthma, this is one of the inhaled corticosteroids that will be helpful, right? But not for acute attack treatment. No. Here you can be given Flovent HIV in children greater than 4 years, Flovent Diskus in children greater than 4 years, Arnuity Ellipta in those greater than 5 years, ArmonAir Digihaler in greater than or children that are 12 years, and then ArmonAir RespiClick in greater than or the children that are just 12 years. Still on uses, in the treatment of eosinophilic esophagitis per oral, in pediatric or adult age group, you use it per oral and swallow. You can use metered-dose inhaler that should be primed. Tell the individual to swallow, not to inhale. Then no food, no drink for the next 30 to 60 minutes after you have administered if you are targeting eosinophilic esophagitis. In pregnancy, it is okay to use Fluticasone, but we must use the lowest dose possible. Now, drug-drug interaction. If you are familiar with my channel, I don't delve into drug-drug interaction a lot because so many drugs can interact with so many drugs. So I'll leave that to my other group of health providers like pharmacists, clinical pharmacologist, or a physician. But today, let me quickly delve into this, that fluticasone is metabolized by hepatic cytochromes, cytochrome P450 and CYP3A4, but mostly by this. If another medication is used concomitantly, and that medication has the capability to inhibit hepatic cytochromes, like Ketoconazole in the navel, and the list goes on, that will lead to a lot of trouble here. Then we will run into increased effects of fluticasone, either the side effects or toxicity, with profound hypothalamic pituitary adrenal axis failure. Now, I want to enter this house, and what am I looking for there? I want to check out for possible adverse reactions and warnings when it comes to the use of fluticasone. Like, we've gone through how useful this medication could be, but that is not without some unwanted effects in the system. These unwanted effects, known as adverse reactions, might be depending on the dose that we're using and how long we've been using it, and other concomitant comorbidities in the patient using this medication. And it's going to target hypothalamic pituitary adrenal axis. Now, adverse reactions. That may be fatigue, malaise, headache, oral candidiasis, arthralgia, musculoskeletal pain, throat irritation, hypertension, subarachnoid hemorrhage, pain, dizziness, and pruritus. Other adverse reactions include viral infection, abscess formation, flu-like symptoms, epistaxis, fever, edema, migraine, Cushing syndrome, oral mucosa erythema, oral mucosa ulcer, weight gain, keratitis, allergy rhinitis. Also, there may be glaucoma, wheezing, pneumonia, bleeding, peptic ulcer disease, osteoporosis, behavioral changes, and hypersensitivity. Others will include upper respiratory tract infection, nausea and vomiting, gastroenteritis, mood changes, blepharic conjunctivitis, and increased intraocular pressure. Toxicity or overdose. In this case, hypothalamic pituitary adrenal axis failure will manifest in the face of fluticasone toxicity or overdose, and that is an acute emergency. We are going to notice hyperpigmentation, and the affected person will be fainting spells. There will be no appetite, there will be depressed mentation with profound weakness and fatigue. That's an acute emergency. Now, monitoring. In children that are on this medication for a long time, then we should follow them up with growth chart. So there must be growth monitoring, of the children. Then there will likely be the trouble with hypothalamic pituitary adrenal axis. Remember, before we entered into this segment, I have made reference to that. So we need to know the signs and symptoms of hypothalamic pituitary adrenal axis failure. So like there will be hypotension, nausea, vomiting, fatigue, okay? The individual will become very weak, and there may be hyperpigmentation. We should have pulmonary function tests done because we are using this to handle asthma, COPD, and so on. So let's know what's happening to the lungs, how effective they are right now. That will even give us a clue whether we're winning or not. Then liver function test, why that? Because it is metabolized by the hepatic cytochromes. And remember I said earlier that even hepatic cytochromes inhibitors like Ketoconazole will affect the metabolism of this medication. Then we ask ourselves, from the history we're going to take from the patient, or if we are the ones using this medication, that is this asthma improving? How many attacks at night and how many days in a week? We want to find out. Then diving into one is right now, we cannot stop this medication cold turkey, meaning we cannot just decide today, I'm done. I'm not going to take this medication again. No, please don't do that. So we can't stop this medication suddenly. If there's milk allergy, if the answer is yes, I have milk allergy, then there are brands that cannot be used. Flovent Diskus, Arnuity Ellipta, ArmonAir RespiClick, ArmonAir Digihaler cannot be used in people with milk allergy. Still on one is, we should have it at the back of our mind that this person is likely going to run into hypothalamic pituitary adrenal axis failure. So the individual will come down again with hypotension, fatigue, weakness, hyperpigmentation, nausea, vomiting, lassitude, and so on. So we should follow up with that. In fact, we can do ACTH stimulation test. I have that already published right here. Paradoxical bronchospasm is a possibility. Increased fungi and tuberculosis infection is another possibility. There may be immunosuppression, oral candidiasis, and we have to be careful with postmenopausal women. Why that? Osteoporotic bones or decreased bone mineral density. We cannot give this medication in anyone with severe liver disease. Why that? Metabolism will become impaired, leading to toxicity or severe adverse reaction. Also, in patients with ocular disease, we should be careful. And then we should expect changes when we are transferring from systemic steroid to oral inhalation. Remember that while transferring from systemic steroid to oral inhalation, the hypothalamic pituitary adrenal axis will be suppressed, and certain conditions can re-emerge. Okay, the conditions that you have been treating before then can re-emerge. Okay, like rhinitis, conjunctivitis, eczema, arthritis, eosinophilic esophagitis can re-emerge. Examples of where and when we can use fluticasone. Before delving deeper into that, we must consider corticosteroid that has been working for this patient. Now remember, I said that earlier, because you don't change the winning team. And when it's unbroken, you don't fix it. Meaning, you keep doing what is giving you good results, right? The severity of the asthma or COPD or esophagitis should be considered, because that will determine the dose we want to go for and how frequent we'll give it. Then we'll consider the winning or losing trend that will dictate whether we're going to change or change the dose, or even go for another medication or look for additional medication. We can also take note that we can alter the dose of this medication every 1 to 2 weeks. Why are we not saying every 3 days? The reason is we may not get full effect until 2 weeks, even sometimes more than 2 weeks. So we don't rush to alter the dose. Okay, we should think that giving this medication once daily will be better when it comes to compliance or adherency than twice daily. Everybody will want to, well, I would love to just take it once a day and then come back tomorrow and grab it again. Not, I must use it in the morning, use it at night. It's easier. Once daily dosing is easier. Then the cost must be considered. So everyone that will be taking this medication for COPD, asthma, and so on, give this medication at the same time each day. Maybe every 8 a.m. in the morning, okay? Then rinse mouth after. Spit it out, don't swallow, but if you are taking it for eosinophilic esophagitis, then you swallow. Since I'm not an agent of any pharmaceutical manufacturing company, it's easier for me to present all these medications that are on my channel the way they are. I have no reason to be biased, okay? As far as fluticasone fill rate is concerned, lower doses are stronger than fluticasone propionate of the same dose. The fill rate has a higher binding affinity for the lungs glucocorticoid receptors than the fluticasone propionate. Here, Arnuity Ellipta is a fluticasone foray, so we'll start with 100 microgram once daily. The maximum we can give is 200 microgram per day. The emitter dose inhaler, here we have Flovent Diskus, that is a fluticasone propionate. If there's no prior inhaled corticosteroid used in this person, then we can start Flovent Diskus with 8 microgram twice daily, and we can increase the dose after 1 week, but the maximum that we can give is 880 microgram twice daily. If we are battling with mild asthma, we can use 100 to 250 twice daily. If it is moderate, then we can go higher, that is 250 to 500. But if we are handling a severe asthma, we can go as high as 500 to 1000 microgram twice daily. Another example is fluticasone propionate under the brand name ArmonAir Digihaler as a dry powder inhaler. In less severe asthma, we can grab 55 microgram twice daily with 232 microgram as the maximum. If steroid is being used before or it is a severe asthma, we can choose higher dose like any between 55 to 232 microgram twice daily, but the maximum will still be 232 microgram twice daily. Fluticasone foreign, that is Arnuity Ellipta, if there is no steroid before, that is, the individual has not been using inhaled corticosteroid before now, we can grab 100 microgram once daily with 200 microgram as the maximum. But if the individual has been using inhaled corticosteroid before, then we start with 100 microgram to 200 microgram once daily, with 200 microgram per day as the maximum. The aerosol powder Flovent Diskus inhalation at 50 microgram per blister or 100 microgram per blister, 250 microgram per blister, or Flovent HIV inhalation 44 microgram, 110 or 220 microgram. Arnuity Ellipta inhalation 50 microgram, 100 microgram or 200 microgram. In conclusion, Fluticasone is a great inhaled corticosteroid, even as a topical cream. We have to use it daily, and is not the sole medication in acute asthmatic attack. Review again what we said here and use appropriately. Also, please take note of the contraindications. Those with milk protein allergies, what they cannot use, the warnings, the adverse reactions, and be careful, we will not use this with hepatic enzymes, particularly cytochromes inhibitors, so that we don't run into toxicity or overdose and profound hypothalamic pituitary adrenal axis failure that may actually kill the individual on this medication. With that, I've come to the end of this presentation. Thanks for your time. Please share this with everyone, wishing every affected people well. Thank you.